So next we'll come to the Dr. Chintan Shah. Please.
Good evening, everyone.
Dr. Prithvi, please come and occupy the dais on the right side, please.
The title of my paper is Impact of Glaucoma on Vision in Children After Blunt Trauma, an Ocular Trauma Score-Based Study. So the most common question that we get as clinician when a child presents to us with a trauma, that what is the visual prognosis? And how do we do that? How do we calculate the visual prognosis? So the ocular trauma score is given by Kuhn that we use to estimate the visual prognosis after 6 months of the trauma. But glaucoma has not been a part of ocular trauma score. But in the author's experience, the glaucoma does play an important role in predicting the final visual acuity. So with that in mind, the study was conducted with an aim to find the utility of OTS in predicting visual outcomes in CGI cases presented with ocular hypertension, and what are the factors which affect the final visual prognosis after CGI. This was a retrospective analytical study conducted at Sadguru Netra Chikitsalaya, and we took the patients of ocular trauma from 2015 to 2022. So any patients, children who presented with acute traumatic glaucoma within a month of trauma were included, having at least follow-up of at least 6 months. Any other types of glaucoma were excluded. The data collection included the trauma details, the standard demography, anterior posterior segment details, and the management. The standard definitions were used to document the ocular hypertension and glaucoma, and OTS score was calculated at the presentation. The standard statistics and appropriate tests were applied. Coming to the results, the study included 124 eyes of 124 patients with the mean age of presentation being 11.4 years. The majority of the patients, that 88% patients were males. Now coming to the presenting visual acuity, the majority of the patient had poorer visual acuity, while more than half of the patient had visual acuity of grade 4, that is less than 4 by 200. Now this table represents the clinical features at presentation, and you can see that the patient presented with a variety of plethora of features. Almost half of the patients had corneal edema, hyphema, AC reaction, and cataract at the presentation. And the commonest finding was angle recession, which was seen in 77% of the patients. Now this table represents the ordinal logistic regression to predict the final visual acuity from the ocular trauma score. So what we did here is that we tried to find out the predictability of the score, whether it was better than NPL, better than PL or HM, better than 20 by 200, or better than 20 by 50. So these are the visual acuity score grades which are given in the OTS system as well. So here this table we have used only OTS score, and we found that the predictability of estimating final visual acuity was only 43%. So almost in more than half of the patients, the OTS failed to identify or failed to predict the final visual acuity. So now we did the multivariate regression analysis that I won't go into detail, but we found that these are the factors: the cataract, subluxation, severe cupping, macular scar, AC reaction, and the zone 2 or 3 of trauma were associated with the poor visual acuity at the final visit. So based on this, we now in this table, this is the same ordinal logistic regression, but here along with the OTS score, we also included all those covariables which had an impact on the final visual acuity. And we found that it increased the accuracy of the technique to 66%, which was initially 43% only. Now here, instead of using ocular trauma score, we included all the factors which are used in the ocular trauma score system along with other covariables. And this system found that the accuracy increased to 76% compared to 43% based on only ocular trauma score. So to discuss that, we found that traumatic glaucoma indeed has a significant impact on the visual prognosis, and our patients, they had likely to be having poorer vision than what was predicted by ocular trauma score system. Now there are several problems with the OTS, that there is no consideration for the children or the younger age. There is no consideration whether it was for OGI or CGI. And if you see the here OTS score 2, there is a raw score between 45 to 65. One cannot predict the final visual acuity. It can range from NPL to 6 by 6. So why we think glaucoma is relevant? Because the pediatric glaucoma is quite different. They don't respond to AGM, and the chances of trabeculectomy surgery is very high compared to the adults. Because in the adults, the raised IOP, acutely raised IOP, can be controlled with the medical management alone. Like this is our previous paper where we found that almost 46 patients out of 85 underwent trabeculectomy. This is another paper by Kalamkar et al., where also 24 patients of the CGI required trabeculectomy surgery. So there is very high rate of trabeculectomy surgery in pediatric traumatic glaucoma. Well, limitations are that it's a retrospective study. Several examiners were involved over 6-7 years period. So to conclude that ocular hypertension on presentation is a very important factor which can lead to poor visual outcomes. And the injuries which involve zone 2 or 3, severe grades of AC reaction, severe cupping, cataract and subluxation at presentation are associated with poor visual prognosis. These are my references. Thank you.